part of that preventative medicine at Human Longevity, you encourage people who have no symptoms at all, who feel healthy, to come into the clinic. So can you tell us a little bit about that?
Sure. I think what's interesting that a lot of people maybe don't think about is I think the way it's sometimes been portrayed is that health and disease is very much you're healthy and then you're sick. But it's actually always like a spectrum. It's not like you're like 100% healthy and then all of a sudden you got sick and there was no predecessor of like changes that's occurred. It's usually always a timeline of slowly worsening. It's just that we don't feel it until it gets to a significant level. What we're really hoping to do is to catch diseases at a much earlier stage, even if they're asymptomatic, because I'll let you know, like I've had multiple members and patients now where they've come into HLI for fun because their spouse really wanted to do it. And we've actually found significant findings like brain aneurysms and or early stage cancers or cancers where even if it's farther along, it's not gotten to the point where it's irretrievable. So for us, it's really important for people to really understand that to have cancer at stage 3 and 4, the mortality rate is significantly higher, 70s, 80s, that kind of like mortality rate, than compared to someone finding it at stage 1. The
Mhm.
mortality rate on that is incredibly low. So as we age, our cells have this thing where it's constantly, dying off and growing and things like that. And so when there's usually like errors in the cells, they have this thing called apoptosis where it kind of dies off to kind
Mhm.
of save your overall body, and it gets rid of the bad ones or the broken ones, right, if you
Mhm.
will. But sometimes with cancers like that then doesn't occur and the cells actually grow and they're like mutated cells and they're not healthy cells, and so there's no checkpoints that normally can occur with healthy cells to kill off the bad cells. So the point is that as we age, that typically is a higher risk because aging is inflammatory, and aging, if you think of your body as a machine, which it is, as a machine ages, there's going to be more, issues that pop up. But if
Mhm.
you like tune up your car or tune up your body earlier on, those kind of little things that start to occur, if you fix it and address it earlier on, they become non-issues. I've had multiple clients where they had stage 0, 1 kind of stage 1 cancers where they went in, and because the tumor is tiny, they just cut it out and the patient was done.
Mhm.
Versus if you look at these, patients and they actually waited until it grew and it was in the bones and it had metastasized to other organs, that's a very different scenario than if it was like a tiny circumscribed, a tiny like isolated lesion that they can go in and cut out. So, in a lot of these cases, they've been really positive stories. Like, for example, the 40-some-year-old women or clients where we've had like, whether it's tumors or cancers or brain results, like we actually have been able to help expedite their care. And they had it addressed within a week or 2 or 3. And then they're fine. Like one woman thought she had just menstrual period headaches, but she actually had a brain aneurysm. Her grandmother actually died in her 50s, and we went in and found it, and then within a day we had it confirmed on imaging again with contrast, and within another day got her in to see a neurosurgeon, head of neurosurgery at a hospital, and then within like a few weeks she had the surgery done, and these headaches that she thought was her period actually were the aneurysm because she doesn't get them anymore.
Wow, incredible,
Yeah, yeah,
incredible.
very
I
rewarding work for sure.
Yes, totally.
Yeah.
I can see why you love it so much.